today who's going to be speaking to us about social determinants. Dr. Hauck is a PhD economist at the Center for Health Policy at Imperial College. She is connected to lots of friends of the Institute and has agreed to take questions throughout her presentation today. So without further ado.
Well, thank you very much. And thank you very much for giving me the opportunity here to present our work and for the friendly welcome I had here and to learn about all your exciting projects was really very interesting for me, and also an excuse to spend some time in this really exciting city. So thank you for that. Okay, so I want to present today joint work with two very dear colleagues of mine, Steve Martin and Peter Smith. Many of you may know Peter Smith because he sometimes comes here for visits and always comes back with a very bad jet lag. The work I'm going to talk about is work on the social determinants of health. This was a project, one of these projects where, okay, we have to deliver on this eventually, but it seems so grand and so big a topic that it's always something else seems more important at the time. So it took us a while to find the right approach, or to find a approach at least, to handle this really difficult area. Okay, so I want to start now. So the project started out really with a report that was done by the Commission on the Social Determinants of Health by WHO. It was set up to collect evidence on the social determinants of health, so on things that impact on life expectancy and also inequalities in life expectancy between countries and within countries that is due to causes that are outside of the health sector. Now, the Commission developed really a very big report and extensive body of work and of policy proposals across 12 very diverse areas. So, for example, early child development, fair employment, and good global governance, and many more, and you will hear some more later on in the presentation. Now, the problem is also, although the evidence that they presented was very compelling and was very well researched, it provides really no guidance to policymakers which of the policies are the most effective and which one should be prioritized in order to do something actually about life expectancy. Now, we think that the deep-rooted problem behind this is a lack of a theoretical model, or at least of a theoretical model that is universally agreed upon of population health, because such a model would guide us, empirical researchers, which variables to include in such a model, and importantly, which ones to exclude. Instead of that, unfortunately, we have to usually adopt a very, let's say, random approach to model specification. We just have to kind of find out what works, and this is a common problem, that we all face. Of course, in the case of country-level analysis, this is aggravated by the issue that we do not have many degrees of freedom to play around with. So at the end, we cannot really include many variables in this model. So our research question is, which is daunting and makes everybody hide under the table, I think, what are the most important social determinants of health? Now, if you expect an answer to this question today, I think you will be disappointed, but at least you will maybe see one possible attempt of getting close to an answer of this problem. So the objective of our study is to evaluate for which recommendations of this commission, of this WHO commission, there is some support using available data and using a purely empirical approach. So this is how we boiled down the problem to a certain extent. And the method that we adopted to answer this question is extreme bound analysis. Now, this was developed in the 90s and also in the 2000s by a range of authors, Levine and Reynolds and Salahi Martin, and the work is all published in the American Economic Review. Now, these papers are originally developed for models of economic growth. Now, of course, they share with us, health economists, the same problem, that they have something very important, of great importance for policymakers, and but a lot of potential determinants of economic growth. And they have many different empirical works as well, which found very different sets of covariates to be important in this. Now, what is EBA? It's an empirical method to test the importance of determinants. So it is a kind of structured approach to model specification. Now, the good thing with this is that in theory, there is no restriction on the number of determinants that can be tested or the number of regressors that can be tested in these models. Okay, quickly I will talk about the concept. I will explain it in more detail later on. So the idea is that we estimate a growth or a life expectancy model repeatedly, very often, each time with a slightly different set of regressors. So we take all possible combination of regressors or of determinants that we want to test for. Now each model yields a coefficient estimate for this particular regressor. And all regressions together then will generate a distribution for these estimated coefficients. Now, the original authors of this method said that a determinant has a significant impact on economic growth or on life expectancy if a sufficiently large fraction of the density function will lie to one side of zero, either positive or negative. And that is, then they say, that a determinant is robust. Okay. So my presentation is maybe a bit unusual in that I start with the limitations of the method very openly. So there are two famous econometricians who said very critically about EBA that it is a fun but agnostic, essentially agnostic specification search that offers little basis for a causal interpretation. Now, of course, it is very difficult to find a counter-argument against this. The only counter-argument that possibly can be found is that maybe, well, EBA is not the only way of answering this research question, and it is one of many alternatives, but maybe in certain situations it is the best of many bad alternatives of approaching the problem, like many problems in life are. Previous EBA models were cross-sectional regressions. The first paper, there is one paper that applied EBA to models of life expectancy, which is by a set of Australian authors, and it was published in 2013. I think it didn't get the recognition that it deserved, really, and they very kindly shared their code with us as well, so we are immensely grateful to them. Now our study is the first to use EBA in a panel data context, and also we use multiple imputation techniques to address problems of missing data that we have. Do you have any questions so far, or shall I go on? Yeah?
Is this, I'm not real familiar with EBA. It sounds very similar to like Bayesian model averaging. Is it the same thing with a different name, or is it different in some way?
Yes, it is similar. It's just that it's a frequentist approach. But in fact, the authors have later on published a paper which uses a prior and uses Bayesian methods for this. And in fact, I have an econometrician colleague of mine, and we work together on implementing this Bayesian method. Okay, so our first job was pretty tedious. Our first job was tedious because we went through the report of the WHO, and we tried to kind of summarize this report in order to get a handle on the issue. So there are 12 chapters, and each have 2 or 3 suggested action areas for policymakers. So these are the different chapters of the report. And then examples for action areas are, for the first one, equity from the start, is, for example, early child development and schooling. And for market responsibility, it's consider health impact in economic agreements and reinforce the role of the state in providing basic services. So basically, this is how this report is structured. What we did then is we basically summarized all the interventions for each action area, for each chapter, into the interventions that were actually mentioned in the report. So just as an example here, for equity from the start, we have continuum of care for mother and child, promotion of breastfeeding, and some other interventions that were suggested by this WHO Commission. Now, the data that we are using is the World Development Indicators, WDI, from the World Bank. And it covers the years, or we use the years from 1990 to 2011. Now, it has many problems, this data set, but it is overall considered, I think, by many experts as the most current and accurate global development data available. And the World Bank, in fact, goes apparently to great efforts to achieve consistency across countries and across years in the variables that they have information on. Now, we estimate models separately for 4 country groups. We have low income, lower middle, upper middle, and high income countries, which we separately investigate in the following analysis. Now, people of you who have used the WDI before, they will know that the WDI has many variables, so we needed to make some choices which variables to choose. In particular, if we had some variables which measured essentially the same concept, like schooling, for example. So we tried to adopt some kind of more objective criteria to the selection of determinants. First, we said we want fewer than 50% of missing values across our whole observation period. In some cases, we had to loosen that a bit to 60%. We want consistency in variable choice across country groups so that we can compare variables a bit. And if we are still ended up with with a lot of variables measuring the same thing, then we would just take the one with the fewer missing values for practicality. Okay, so here you can see an example of how we approached this. So basically here you see again for early child development the WDI variables that we think measure attainment in these sections. Now you see some of them, and here this plots the missing values for low-income country, this plots the missing values for lower middle-income countries and so forth. So you can see that for some, for example, literacy rate, which would be a great thing to have. Unfortunately, we have a lot of missing values, so we do not include this in the analysis. What we do include is primary school enrollment. We have for that 25% missing, so it's kind of acceptable. And we did this for all the other indicators as well that we went through a long list of tables here. Now, we impute missing values with multiple imputation techniques. I mean, I have learned from you today and yesterday as well, talking to you, that you are really the experts on multiple imputation. In fact, it was Steve who did the imputation, so he basically told me what to tell you here on these slides. Any questions, I have to refer to him. Now, what multiple imputation generally does, it uses the distribution of the observed data to estimate a set of plausible values for the missing data. So we incorporate the uncertainty which arises from the mere fact that the variable is imputed. We build this into the overall model estimate, and it will impact on estimated standard deviations of the coefficient estimates. What we do is we generate 50 imputed values for each regressors, and then we will estimate that separately with an identical fixed effects panel data model to generate a set of parameter estimates. Now, then they are combined according to a set of rules, and we will have one coefficient estimate and associated variance per variable from this. Now, the method that we have used now for this presentation is predictive mean matching by chain equations, but we have also experimented with other things with standard chain equations and with the Amelia procedure. But I think Steve banged his head a bit against the computer with that one. So for the moment, we are sticking with predictive mean matching. Now here are some trace plots, which basically tell you for a single chain, for a single imputation for one of our 51s, how the mean and the standard deviation, which are missing for some of the countries. So this one here is immunization for diphtheria. This is immunization for measles. So each point here represents one iteration of this iterative procedure towards a kind of probability or of the probability distribution at the end. So we can see here we plot 100 iterations, and we can see, or at least Steve said, okay, we're happy with this one, but he wasn't so happy with this with these trace plots this is now, I think, sanitation, where we can see a trend. here exhibiting. So we might need to increase the number of iterations for this. Okay, so now I come to the model that we are actually estimating. So our dependent variable is life expectancy in country I at time t. We include in this model one fixed variable in each regression, just one, and this is healthcare expenditure. So this will go into each and every model we estimate. Then we have one variable of interest, and this is the object of the robustness test. And then we have 3 control variables, and they are changing for each regression. Now, then we have a constant term, we have VIA dummies, and because it's a fixed effects model, we have here this country fixed effects that will be differenced out in the estimation procedure. Now, really, anybody will say this model is underspecified. I'm sure there are more variables than the 1, 2, 3, than the 5 you have in here. But we think that unobserved, at least unobserved time invariant variables will be captured in the fixed effect, and therefore, while we cannot place any economic interpretation on the coefficient estimate on the fixed effect, we can at least say we can at least say, okay, it will purify kind of the estimate of the variable that we are interested in from the biasing effect of any such variables. Now we estimate this model repeatedly, each time with a different set of control variables for ZIT. Each regression will yield a coefficient estimate of the slope coefficient for the variable YIT, the one we are testing, and all the regressions together generate a distribution for this estimated coefficient. And then we do the same procedure again for another variable and include again control variables here. So the original paper by Levin and Reynolds said that a variable is a robust regressor if the extreme bounds of the distribution have the same sign. But later on, this was kind of relaxed by Salah E. Martin, who said the variable is a robust regressor if a certain fraction of the distribution of the betas lies to one side of 0. Now it's down to the person, to the researcher, or maybe also to the policymaker, to set a confidence level or a threshold level of where, of what kind of how much they accept that the distribution will lie to the other side of 0. I will explain this better later on. Now the test amounts to computing the value of the cumulative density function at exactly the point where the coefficient estimate is 0. So this then tells you the probability, basically, that the true beta is smaller or larger than 0. Now, for mostly negative regressors, we evaluate the cumulative density function at 0. And for mostly positive regressors, we need to swap it around, and we need to evaluate the inverse of the cumulative density function. Okay. So I will explain this now with some graphs. So here what you can see is a diagram which on the horizontal axis shows the values of the coefficient estimates. Now in this example on a negative scale, so we are on the left side of 0. And on the vertical axis we have the cumulative probability. Now these one here are all the different beta values that I get out from estimating this regression over and over again that I showed you. So some of them will be very small, some of them will be very high. Now what we can see in this case is that the CDF at 0 evaluates to 1, which means that the regressor is negative with a confidence of 100%, or in other words, the probability that the regressor is positive, so basically on this side of 0, is nil. The probability is 0 that it does this. So we would say this is a very strong, robust, negative regressor. Now, of course, the situation could be that we have some negative coefficient estimates and maybe also some positive ones. Now, here's the situation where the CDF at 0 evaluates to 95%. So here we would say the regressor is robust with a 95% confidence and positive with a 5% probability. So maybe for policymakers or for us researchers, this is still a level of error or uncertainty that we can accept or maybe cannot accept. This depends on the application. Okay, so here we have the case basically of where the CDF at 0 evaluates to 65%. So we may be saying that this regressor is of poor robustness because it is positive with a 35% probability. Now here we have the case where the CDF evaluates to 0.5. So this is basically whether the regressor is positive or negative is equally likely. So basically here we have to say we do not know. I mean, we cannot form any reliable prediction on whether this estimator has a positive or a negative impact on life expectancy. So we better forget about that one. Now here it goes on that we come to regressors that are mainly positive. And here's the case basically where the CDF would evaluate to 5%, or if we take the inverse of the cumulative density function to 0.95. So this is a regressor which is robust positive with a 95% confidence and negative with a 5% confidence or probability. Okay, so this is the basic idea behind the extreme bound analysis. So what we do is we compute the cumulative density function from the means and the standard deviations of the betas from each repetition of the model. Now what we do is we assume that these follow a normal distribution, and I will talk about this assumption later on. Now robustness is not a measure of statistical significance. Essentially, well, it is related to statistical significance, but what we do is for this regression, we also calculate the average p-value across all estimates. Now, what I find quite interesting is that due to that the imputation will impact on the standard errors of the betas. So the imputation will impact on both the robustness and the statistical significance because the beta estimates will have a larger spread, the distribution of the beta estimates. So this makes it more likely to be on the other side of 0. And it's obvious that for statistical significance, the standard errors make an impact. So first we thought, maybe that's not so good, but then we thought about it. Actually, it reflects the fact that maybe there is, due to the missing values, there is just less evidence for policymakers to trust this particular variable, so it's kind of okay. So maybe it's even warranted that it will impact robustness in a negative way. There's just to reflect the poor evidence base for one particular determinant. Now I come to the computational burden of EBA, which is considerable. Now you can imagine that if we have that basic combinatorics will tell you that if we choose 4 regressors from a large possible set, that the numbers of regressions that we need to run will increase exponentially according to basic rules of combinatorics. Now, at the moment that we are still in the that this is still work in progress, for practicality, we approximate results by estimating only 10% of all the tuples of all the possible combinations of regressors. I mean, I've asked some econometrician colleagues of mine, and they said, oh, you can approximate it. And I said, oh, yeah, but how do we approximate it? What's the theory behind it? And they said, oh, I don't know. So I thought, okay, maybe 10% is all right. Once we have determined the final model, then we plan to run it with all the tuples. Now, I just want to tell you now how long the running time is of these models. So for low-income countries, we have 4 variables per regressions. We choose, in the end, 60 from a pool of 64 regressions. The number of regressions which we run is over 500,000. So an estimate of the running time is 3.6 months. For high-income countries, we have more variables to include. So the running time is longer than giving birth or carrying a baby to full term. So we thought, okay, we can't wait that long. Now, if we approximate it by 10%, still the running time is quite long. For high-income countries, 4.1 weeks. Now, of course, this is because one model takes quite a long time to estimate, because we are doing the we are running this on a multiple imputated data set. Now, these running times assume sequential programming, so the model one model run after the other. So we thought, okay, we can't do this. We need to improve on this. First, we spent some money and bought a more expensive version of Stata. And then we let it run on Imperial College Central High Performance Computer. And I programmed it to run in parallel. So for each country groups, I split the regression into 30 batches for the 10% approximation, and we will split it in 300 batches for the full model. So that basically the high-performance computer will always estimate 30 models at the same time, or 300 models at the same time. Now, the running time now for the 10% approximation is still between 3 and 5 days per country group for the 10% approximation. Now this, I thought I have to include this, is a picture of our high-performance computer. This is just one part. So you see, I don't know, you cannot see this very good on this picture, but each one of these little things here is basically one core, and they're all connected with each other with little pink and blue cables and submit jobs to each other. So yes, so we kept it busy. Okay, so for presenting the results, we will present this on a probability scale. So we decided against using arbitrary thresholds of 95 or 90% confidence level, but we just present the value to which the CDF evaluates, which is the probability that an estimate, that a coefficient estimate is larger or smaller than 0. We will also, so this avoids setting any arbitrary thresholds, and you can decide yourself what kind of threshold you want to adopt. We also present the average p-values from one-tail tests across all models. So we just take the average of the p-values. Now we find that there is a strong association between the two, but it's not perfectly one, this association. Okay. Do you have any questions so far before I go on with the results? Okay, maybe you will have later. Okay, so this is a graph which nobody can read. It's just that I use this now to explain to you how I present the results for you to understand this. Okay, so essentially what we do on the x-axis, or on the horizontal axis, we present the probability value of the coefficient estimate being either larger or smaller than 0. So basically, this is to what the CDF evaluates to. For positive regressors, this is 1 minus CDF at the value of 0 of the coefficient estimate. So basically, you will have, in this corner here, you will have the regressors which are pretty robust, because the CDF evaluates to 95%. On this side, you have regressors which are not very robust, and at the value of 0.5, as I showed you before, basically these are the regressors which are switching sign between positive and negative, and it's basically indeterminate whether their impact is positive or negative, or indeed whether there's any impact. Now here we just plot the p-value, so this is just the p-value. So down here are the ones which are more significant, and here, up here, the lower level of significance of being different to 0. So in this case here, because it's a positive regressor, this is a test of the coefficient being smaller or equal to 0. Okay. Because it's really hard to read this, what we do is that we basically zoom in on the areas of strong robustness by doing this, bloop. So you will see here that basically it's just the right side of the graph, which is displayed for the strong regressors, for the robust, sorry. And then we zoom in into the areas of the poor robustness as well. So this, I forgot now here but here basically are all the ones which are like 0.5 and 0.6, which are switching. Yes?
So what was the idea behind doing both the p-values and the robustness? And also, I guess I'm
Okay, so your question is what? I was told I have to repeat your question. So, so okay, so I will.
And why did you do both?
Yes. So okay. So your question was what the difference is between the robustness and the significance, and why we do both. Okay. So robustness essentially is, well, in a way, a simplified version is how many of my regressors are positive, how many are negative if I run a model repeatedly. This is nearly kind of what it is. Okay, we are imposing a distribution on this, and then we evaluate the CDF. But a very good approximation to what we find by evaluating the CDF at 0 is count the number of positive ones, count the number of negative ones. I mean, this is what you intuitively do when you're an applied researcher. You just bang in your regressors, and then you see which ones are switching signs like mad. You know, okay, something wrong with that. What's the problem? Then you start to investigate. Then you think maybe it could be endogeneity, it could be multicollinearity, or it could be that really this is not an important predictor of whatever I want to predict. So EBA is just a way really to, if you so want, operationalize this kind of model search that we are all doing. And significance basically would just, the level of significance will do a hypothesis test on the probability that an estimate is different from 0, because here we have a kind of a prior idea of whether we are looking at the positive or negative regressor. We just do a one-tailed test, basically, of whether a positive regressor is smaller than 0, or for a negative one whether it's bigger than 0. So one is just comparing this, how badly does the regressor switch signs, and the other one is the hypothesis test.
I have two questions. Do you model male and female life expectancy separately? And
yeah. Yes, so your question was whether we model male and female separately. We have thought about that, but because we are somehow daunted by the estimation effort at the moment, we are just estimating total life expectancy.
And a second question, do you have things like smoking, alcohol, obesity in the model?
So you ask whether we have lifestyle factors in the model as well. No, we don't. I mean, we have run models with the variables that we have from the WDI, which is HIV prevalence and things like this. But because this project is about the social determinants of health, so things which are lying outside of the health sector, we do not include this. Now, if the proportion of individuals who are smoking or who are alcohol dependent does not change over time, it will be captured in our fixed effect. Otherwise, it will be in the error, on the time invariant error. Yes?
Can you elaborate on how you get the CDF? Are you combining a different combination of the confounder that you are controlling for? How is the CDF generated?
Okay, there are two ways of doing this, and at the moment we are just doing one way, but we have started doing the other way as well. So the first way is we take basically the moments of the empirical distribution of the coefficient estimates. So we take the mean and the standard deviation, and from that we estimate what the normal distribution looks like, and then we draw the CDF from this normal distribution. Now the other way of doing this is to establish an empirical distribution and then to draw from this empirical distribution. The problem that is there, which is more computational, is that we may not observe exactly the value of 0 for the coefficient estimate. So we need to take a value closest to 0, and we haven't quite figured out yet how we want to do this.
So when you say like you take different combination of the other factor while you test for robustness, so how does those combinations fit into here? Like let's say that's employment. So employment is the variable of interest, and so you have another subset of variable that you alternate.
So basically what is done when you have employment here, this the estimate here will come from around 60,000 regressions.
There are different model specifications.
Yes, from different model specification. So it will have gone through all possible combinations of what they are, of the 3 control variables that are drawn from all the others, basically. So, the set of regressions that we estimate is exhaustive.
So can I just keep asking?
Yeah, go.
Why does it matter whether it go positive, negative, because like the beta would naturally, so depending on what subset you include, you could include a subset of other covariate that can change your beta now to a negative, and if a different subset is chosen, then it can be positive. So having a beta that switches back and forth because you have a different selection of other covariates, it seems like it is not wrong to me.
Well, that is an important point that you make. So you say essentially, well, the fact that it switches signs is not necessarily a bad thing. I mean, this is the idea of the EBA analysis. They say if we have a model that switches signs, if we have a determinant that switches signs depending on what other variables are put in, then we consider this as not a good thing. We consider this as a determinant which is an unreliable predictor of life expectancy. Now this, I think, is an argument that can be discussed, I think. And also I think there are many sources of why, or many reasons why a regressor is not robust. Yeah. Yes?
Consider the variability of these indicators within country and between country, or just between countries?
Pardon? I think I didn't get your question. Could
Did you consider the variability both within country and between countries?
Yes, we do, because we estimate a panel data model. So essentially we say we account for variation across countries, and we also account for variation of one country over time in estimating a panel data model.
I mean, for example, we have within country, we have different socioeconomic groups with different life expectancy.
Okay.
Consider this variability within country.
Sorry, I didn't understand your question. Okay, so you are asking we have different subgroups within one country, and whether we consider, no, we cannot consider this. So the estimate we have from the WDI is basically the average across the whole population. But I mean, there's no reason why this couldn't be repeated for like subgroups within a country. Yes?
The results of the CDF analysis are conditional on the number of control variables that you're including in your models. Are you considering expanding or diminishing that just to see how robust this method actually is?
Well, expanding gives me a bit of headache, because expanding means like another month tagged on. So no, I mean, sometimes other models of EBA have been estimated with 3 fixed variables. This is, of course, a way of reducing the computational burden, because if you include them all the time, then you don't need to have them in your set of tuples that you construct. So that's one way. But we have estimated before models with more fixed regressors, and we have found that there might be some collinearity or endogeneity problems. So what we thought is it's best to just include one variable where we are really sure that we want to have this as a fixed regressor. But I mean, of course, in principle, it would be best to include all variables in there, but the problems are, I mean, it's obvious that we cannot do this due to the degrees of freedom problem we have, apart from the computational burden.
My question is related to both Marie and your question. So the choice of the regressor that you include in your model, did you go through each combination thinking that could have like a multicollinearity problem or an endogeneity problem? Because I think that's the only reason why, like Marie's question, when the beta coefficient changes only because due to the combination of regressor that you have in the model.
Yeah.
That is a different reason if the coefficient changes just because there is not evidence about the sign.
Well, what we did is we tried to change the way we tried to take account of variables which have a very high collinearity and exclude them. But we didn't find this, well, we weren't so happy with the result because, I wrote this code to just take out the variables which are highly collinear, but then it was more or less random what variables were taken out, and I wasn't quite happy with this, so I thought, okay, maybe it's better we leave it in.
I think multicollinearity you would lose significance, but maybe endogeneity would be a bigger issue.
Yes, I think so as well, yes. So we hope to get around some of the endogeneity issues by using the fixed effect specification. Yeah. Maybe should I go on, or is it okay if we postpone a bit?
Just remember me.
I remember you. Okay. Sorry. Okay. So here, because I want to have the opportunity to show you a bit of the results that we got. So here you can see now for low-income countries, regressors with a poor robustness. So this is basically for all regressors where the CDF evaluates to 80% or less. So basically here on this side we have regressors which are switching signs constantly. Here we have regressors which are a bit better really. But overall I would say, okay, these are possibly regressors that we would consider not robust predictors. So we have here, for example, well, I start here because these are the worst. So we can say that here poor robustness is agriculture. This particular measure of primary education, which is gross intake ratio in first grade of primary, vitamin A supplementation coverage, foreign direct investment, food production index, rule of law, which is an indicator from the Worldwide Governance Project on how well a country establishes law and order, essentially, and other variables that maybe you're welcome later on to go into further details. So now, these are more regressors of poor robustness. We have here merchandise trade, poor, the percentage of the rural population, paved roads as a sign of infrastructure is not very robust, and energy use as well. Now I come to the regressors which we found to be of strong robustness. So we can see that here in this corner, basically in the bottom right corner, are the regressors which are very robust and also which have a very low average p-value across all the different regressions. So these are the kind of variables that we would say are robust predictors of robust and statistically significant predictors across all the many model specifications that we estimate. So among them are arable land, which is the percentage of the land area which is dedicated to agricultural production. We have government effectiveness, which is an index from the World Governance Project on how effective a government is lack of corruption and things like that. We have health expenditures per capita for low-income countries as a strong, robust regressor. Labor participation rate, also improved water source. So this is like piped water, access to piped water. Then something I like, which is labor participation rate of females, which is as robust really as the total labor participation rate. And then the length of the secondary education. Now also a positive regressor, a positive and robust regressor is the CO2 emissions from solid fuel consumption, which may be an indicator for low-income country of the level of development. Here we have more strong regressors. These are the ones which have a negative impact on life expectancy. So we can see that basically the higher the total debt services of a low-income country, the lower is the life expectancy. Refugees in the country also are a very robust and highly significant regressor, and other things. So now it's impossible to go through all the different results, but maybe I show you for lower middle income countries, the ones with a strong robustness. So we can say that a strong positive robust regressors for lower middle income countries is the net overseas development assistance which a country receives. Then the foreign direct investment, so this is kind of a measure of the strength of the private market economy, and other indicators. So I mean, I remember that for low-income countries this was not robust, so maybe this is a sign that there's slight differences between countries which have crossed the threshold of being very poor. Okay, so these are also positive. I think the ones before were very positive. So here we have also, which I like as well, school enrollment primary of females. So this is just females and not total ones. And some other indicators like births attended by skilled health staff, and so which we include as one of the only regressors of the quality of the healthcare system. And also what we see is that GNI per capita is a robust regressor here. So although we distinguish, we do the subgroup analysis for the different income levels, we can still see that obviously there is quite a lot of variation between countries within the lower middle income category, that this has that this shows up as a predictor. Okay, so now, of course, what the robustness does not tell us, and the information on the statistical significance, is the value of the coefficient estimate. How high is exactly the impact of these variables? I mean, they might be very robust, but essentially have zero impact, or like a very low one. So here now I take the robust determinants for low-income countries, and I just list them here by the average p-value, and I just take the ones which are below 0.05 in the p-value. Now, government effectiveness is a bit difficult to interpret because it's like an index, so what I want to show you now is just how we could interpret the arable land as a percentage of the land area. So that would mean basically if we increase the arable land area by 1%, we would increase life expectancy by 0.05 years on average. Now, there is a lower bound estimate, which is now here covered by my, there's a the smallest beta estimate that we get across all our different specifications is 0.04, and the highest one is 0.07. So there is quite some variation in here, which we, I think, have to take account of. Now, if we apply the result we find to a population of 40 million, then we could say that possibly increasing land area by 1% would increase life years for a country of that size by between 1.6 million and 2.8 million life years, with a mean estimate of 2 million. We can do this for other regressors as well. So, for example, if we do it for health expenditures per capita, we can see that a $1 increase leads to a gain which lies between 2.8 and 5.2 million. And increasing schooling by 1 year would lead to a gain between 2.4 and 4.8 life years. Now, of course, the economist in me thinks it would be great if we could now continue this work and we could say how much does it actually cost to increase 1 year of schooling, compare this with the $1 costs of increasing expenditure by capita, and comparing it with how much it costs to increase the arable land area by 1%. And then it would be really interesting to see which one kind of buys us health for the lowest price. But this is a potential extension to the model. Okay, now I have estimates for the other countries which I don't have time to go through now, but which if you come, I'm very happy to show you. Now I just quickly want to talk about the assumption of normality we do. So we assume that the estimates are normally distributed, and as I said before, we estimate this from the moments of the empirical distribution. Now for most determinants, this seems a good approximation, and on the following slides I plot the normal cumulative density function, which is constructed from the mean and standard deviation that we get out from our beta coefficient estimates, and also the empirical CDF, which is the blue one. So we can see here that here this is quite a happy approximation, the normal distribution. I mean, at the end of the day, we have to see that really what matters is the difference between these two distributions at the value where beta is exactly 0. So really what happens at other points is not really that important, because this is the point where we evaluate the cumulative distribution function. Now here I show you 4 determinants where we are possibly less happy about the approximation that the normal distribution gives us here. And so for example here it might make a difference, because if you go here to the coefficient value of 0, you can see that the estimate might be here different if you take it from the empirical or the normal distribution. Okay, so now I'm not sure if I have much time now to summarize the results. I have here a summary also from the country groups that I could not show you, from lower middle income countries and high income countries, but maybe to come back to your question, which I have not forgotten. I will just now go to the conclusions. So we can say there's some support for the importance of social determinants outside of the health sector, at least using this method. We can say overall that quality of governance, schooling, gender equality, export and the health of the private sector economy, and armed conflict. This is a negative impact, and only for lower income and lower middle income countries, that we find that there are robust regressors, and also that the average p-values or statistical significance is quite high. We have, though, some difficulties showing the importance of some others, consistently at least. This is surprisingly overseas development assistance for low-income countries, whereas we can show for overseas development assistance, which is only directly directed at health, there is a robust impact, but not overall. Then a bit difficult is also labor participation for some countries and early childhood interventions, but it could be that it's correlated with our fixed regressor, which is healthcare expenditures, so it might be that this is an impact. Okay, so to wrap this up, I think extreme bound analysis is just simply a systematic approach to a model specification search that we conduct as empirical researchers really every day. I think that the robustness of variables is impacted on by a number of factors, like you mentioned before, or like you said before as well. It cannot replace a theory, and it does not really provide a comprehensive answer to which determinants are the most important ones, but it is one way, I think, of looking at a very difficult problem. So it is work in progress, and comments are very welcome, and I will sit in office 644 over there for a while longer. Anybody who wants to chat with me is very welcome to do so. Okay, thank you very much. Okay, so you are first.
I have two questions. And going off of what was asked earlier, did you include smoking, obesity? I was wondering what your threshold was for what was considered a health determinant and what one was a social determinant. From, I think, a lot of people's perspective, skilled birth attendance, immunization coverage, that would actually be a pretty strong health determinant, or health determinant of health, or health intervention, and less of a social determinant. So I was curious if you could say, what is that cutoff of what you include or not as something that could be in between? And relatedly, I think when we're doing a lot of evaluation work and trying to figure out the impact of health interventions on an outcome, we end up including a lot of some of these non-health factors. And it seems, especially when the results are being used to say this is the number of extra years that could be saved by improving these non-health factors, it seems pretty important to actually include those health interventions, because then you're not potentially attributing what they're actually contributing to improvements in health.
Yes.
So I guess the latter question, just hearing a little bit more on your perspective on that, and kind of but what that threshold is.
Yes. Okay, so to summarize, your question was about how we selected really the social determinant or the determinants of health that would go in our analysis and which ones not. So I mean, essentially we were really very closely guided by the report of the WHO Commission on the social determinants of health. So basically we went through the report very carefully, and we tried to find the matching indicators from the World Bank. Now, of course, there were some things which were mentioned by the WHO Commission, such as inequality, for example, or the Gini index of a country, inequality of wealth, which were considered important by the Commission, and probably they are. But the number of missing variables in the WDI was so high that it didn't make our cutoff. So in a way, the problem is, of course, that there are some indicators in here, not in here, which should be in here because we don't have data on it.
But that doesn't really answer my health question.
Okay.
Skilled birth attendance is an intervention, it's not a social determinant of health in many
Yes.
spheres. So how do you say that something's not a health intervention?
Okay, so you ask for the skilled birth attendants. I mean, first area of the report is, I think, equity in early start or something like that. And they said that mother and child interventions is part of that package. So we thought, okay, let's find indicators for that. Now the indicators we found was breastfeeding or promotion of breastfeeding, but had too many missing variables. And we found these births attended by skilled staff. Now, I personally doubt a bit as well whether it should be in the analysis or not. But if you so want, this report is kind of our theory that we want to test. So this is why we kind of included this variable. Yes?
I think Laura and Maria already sort of talked about this point a little bit, but worrying about sort of the correlation between variables that are potentially picking up on the same effect. So if you have something that's picking up on urban development or something, and there's multiple indicators that do, if there's maybe 5 variables that are all picking up on a similar effect, you potentially risk washing out the effect when you're on average including 2 of the same progression.
Mm.
Do you think it's possible to sort of do any sort of like factor analysis or that kind of thing to see which variables are tightly related, sort of what groupings there might be to look out for that?
Yes, I mean, what I did, as I said before, we did this basic correlation analysis, basically, we wrote an automated routine to drop the variables which are highly collinear. But then we weren't quite happy with how this dropping happened. I mean, the problem is that you can't really go handmade through so many variables, so although maybe you could, yeah, I don't know, but we wanted to kind of, I think the basic idea was really, this whole project came about because Steve Martin said, I don't like this EBA approach, it's too automated. I want like the more approach, where I think about it, I try out different models. So he did his thing, and I thought, okay, let's try the other side. So it was like a man versus machine thing. So I'm being the machine, Steve being the man, in this. And actually the project is bigger than I now could present here because there's also the part that Steve did with the parsimonious model, and it's quite interesting to compare similarities and differences between the two approaches. I hope that answers your question. Okay. Yes?
In your current analysis, each model weighs equally, right?
Yes.
Are you considering to weigh the actual estimates by the likelihood of the model, or in your future Bayesian approach actually the model probability?
Yeah, that is a very good point, because actually the original paper weighs each model by the inverse likelihood function in order to give greater weight to the models which are more likely to be a true fit to the data. Now, the problem that we have with this, we wanted to do this, is when multiple imputation, at the moment, I could not find any paper which tells me how to calculate the likelihood across multiple imputated data sets. And even the R, then I thought, okay, maybe I take the R square, but the R square is not available either. So, maybe some of you experts on multiple imputation here can tell me how we could do this to weigh basically by some kind of quality of the model, some kind of criterion for multiple imputated data.
Well, in the Bayesian context, you could include a model for missingness in data basically, and have one probability model for the entire data set that you run once.
But I thought we kind of take account of the missingness because the spread of the distribution of our beta estimates will be larger for variables which have a lot of missing values, no? Because the standard error is higher. So implicitly, we kind of take account of the error due to the imputation or the uncertainty arising from the imputation. Okay. I don't know, but I think this is something to think about. So any ideas? Very happy about comments.
Let's leave it there and thank our guest speaker one more time.
Well, thank you very much for all your participation.